Hello and welcome to In Case You Missed It. So we had a big State of the Union address and Donald Trump talked a little bit about healthcare, but not much. So we covered drug prices and Trump RX, which is more show than go. There's only a limited number of prescription drugs for the Trump RX program. Anything that saves money on prescription drugs is great, but is it going to impact all of us? Who knows? I talked about the Affordable Care Act and insurance costs. He's not going to be bringing back these enhanced subsidies. You're likely to see some movement around providing dollars directly to Americans to cover medical expenses. And then he talked about Medicaid and fraud concerns. So we'll talk about more of that in a second. Overall, the State of the Union address was 107 minutes, and there was barely just a few minutes dedicated to healthcare, signaling you're not going to see much on the legislative front in this year. Speaking of healthcare fraud, just a day after this speech that we all heard, the Centers for Medicaid and Medicare Services said it would withhold $260 million of Medicaid funding for the state of Minnesota. Seems like it's a little retaliatory. Minnesota's been in the news a lot, but they do feel like there is a lot of fraud there. Expect other states to get hit with this withholding of funds and expect them all to be blue states. Not no red states you're going to see getting with funds withheld. The Congressional Budget Office is predicting the Medicare Trust Fund will run out in 2040. This is 12 years sooner than they predicted last year, and it is the result of all of those cuts you saw being touted by this administration through the One Big Beautiful Bill. It's the funds balance is set to grow slowly through 2031, at which point they expect the spending will begin to overtake revenue and the balance eventually will run out in 2040. Again, a lot of these One Big Beautiful Bill provisions start going into effect in 27 and 29. So around 2031 is when we'll see some of these, the trust funds start to take in less money than it's spending. And a new president will be in office, so I'm sure they will be addressing it then. Good news in California and Hawaii. Kaiser Permanente, 31,000 Kaiser Permanente nurses and other healthcare professionals have ended a major strike on Tuesday of this week after about a month on the picket lines. The union had reached an agreement on a number of issues that were important to them, like staffing, workload, and safety. But most importantly, there was an across-the-board wage increase of 21.5%, which I feel had a lot to do with the strike ending. And the last thing for us, we've got a lawsuit coming around ghost networks. Okay, if you're not familiar with the term ghost networks, you're familiar with the problem. You ever logged into an insurance company's website looking for a provider, found them, called them, and only to be told that this provider has not been in the network for many months or many years? That is a ghost provider or a ghost network. Insurance companies are famous for keeping providers in their data portal to make it look like their networks are larger than they really are. These are called ghost networks. And ever since 1974, with the ERISA, the Employee Retirement Income Security Act, this is what governs the federal governance around healthcare plans and health and welfare plans, started in 1974. And ever since that law passed, it has prevented patients with employer-sponsored health plans from using these state consumer protection laws to sue their insurance company over these ghost networks. But in a recent class action lawsuit, we might have found a workaround. So health plans offered by a government employer aren't subject to ERISA. So there is a group of employees from New York State that are suing Emblem Health. They started this lawsuit in December, alleging it violated state laws by failing to provide accurate information about its healthcare plan. So for those of you that have had this problem in the past, we might be finding a little bit of a workaround to hold insurance companies accountable and make sure their networks online are accurately reflecting who's in their network. Thanks for stopping by. See you next week.